Hello, my name is Zachary Young. I'm one of the pulmonary critical care physicians here at Faith Regional. So the newer COVID variant that's running through the area and actually through the country right now, the numbers a couple weeks ago were about 80%, this Delta variant that people are hearing in the news. And unfortunately, this variant has a few different things that some of the COVID that we had seen last summer and into the fall. The biggest thing is the effects on the lung. And what we're seeing is from early studies that it is much more contagious. So people are getting rapidly infected and spreading it much more rapidly. And unfortunately, it's not sparing any age groups. We're having pediatric patients that unfortunately can't be vaccinated yet, becoming sick, all the way up to teenagers into the middle ages and even the elderly. Previously there was, a higher percent of the elderly patients that, became infected, but this is unfortunately not sparing any age group. And what we're seeing as far as the Delta variant, why it becomes so much worse compared to the other viruses, is that people get infected and their viral loads are so much higher. Some of the studies are showing that at day 2 or 3, they have 1,000 times more virus replication in the airways. And this is what we're seeing is affecting the lungs much more rapidly. Likewise, a year ago, people didn't have symptoms for 5 to 7 days after they were exposed to COVID-19. What we're seeing more recently, it's as early as 2 days and about average 2 to 4 days that people start having symptoms. What are those symptoms? Typically very similar to what they were previously, shortness of breath, because this variant is so much more powerful to the lungs and causing so much more lung damage. We're seeing more lung congestion. One thing different than the previous variants we're seeing less loss of taste and smell. So, people become infected, all of a sudden they're becoming much more short of breath and congested, and they're rapidly spreading the disease and becoming much more sick. And that's probably the biggest thing we're seeing is younger people becoming sicker. There have been pediatric patients admitted to the hospital. I've talked to our emergency department colleagues. They've seen numerous pediatric people, patients, even very young patients coming into the emergency department infected with COVID. And that's the unfortunate, myself being an adult critical care physician, we've seen young people in their 20s, admitted to the hospital. Well, we're seeing the COVID-19 virus, just like before, it spread from person to person through most likely droplets. And it's more contagious in the fact that it gets into a person's upper airway or their lungs, and there's a much higher viral load, which is more or less how many little viruses are in those droplets, and then the rate they replicate. And what we're seeing is the replication rate is so much more rapid compared to the previous COVID. And one study I was reading yesterday showed about 1,000 to 1,500 times more higher incidence of viral load at day 4 of people exposed to COVID, which is very scary that you're exposed and all of a sudden you have this rapid replication rate. And the process that the Delta variant is getting into the lungs is through a receptor, and that's what we're seeing is all of a sudden the virus is penetrating into the lungs much more rapidly than the previous episodes. So even some of the medications, the monoclonal antibodies that we use to treat COVID-19 are less effective, because by the time people are getting these infusion rates, the virus is already into the cells, into the lungs, causing damage and having this inflammatory response. So the effects on the lung, which we're seeing, are what we call ARDS, or this diffuse inflammatory process of the lungs causing profound hypoxemia or low oxygen levels. And what are the effects of these levels? Just like previous COVID, some people recover pretty rapidly and are doing okay, but unfortunately, there's a lot of people that have become disabled, requiring oxygen and having long-term side effects where they can't do simple things, playing with their children and, normal activities that they could do a year ago without symptoms. And, everybody sees the death rates on the news, but more concerning to me is the amount of people becoming disabled. And I fear that this Delta variant is going to cause more disability and more hindrance in people's lives just on how rapidly it's spreading and the effects on the lungs. The only way to prevent this Delta variant right now is the vaccines. And even we've had breakthrough cases with the vaccines. Unfortunately, no vaccine is 100% effective. But the good part about it is we're not seeing people in the hospital or dying that have been vaccinated. There are a few people that have been hospitalized, but they're not as sick. So that's what everybody can do to protect themselves, is become vaccinated. It's never too late to become vaccinated. The process to get full immunity, there's one shot with the Johnson & Johnson and 2 shots with the Moderna and the Pfizer. And those vaccines take a little bit longer to get full immunity. One thing we're also seeing with the Delta variant, previously, 1 shot for people that had small reactions, seemed to be adequate for some of the other variants. Unfortunately, Delta variant does not provide very good efficacy for 1 shot of the 2 vaccines. Likewise, with those people that have previously had COVID, do not have as much immune response to the Delta variant as people that have been vaccinated. So we're showing that the vaccination protects better against this Delta variant compared to natural immunity from previous COVID exposure. So even if you've had COVID, highly recommend the vaccine. There's been a lot of confusion and concern with people regarding vaccine versus COVID. Unfortunately, all vaccines, all treatments have their side effects. But as we're seeing, the side effects of COVID are much worse than the side effects of the vaccine. Unfortunately, no vaccine's perfect. However, the vaccines that are being currently utilized have been studied for years. The data on messenger RNA has been out there. More recently, they've been implemented into the COVID vaccine. Taking care of multiple patients this week that have been unvaccinated. Numerous patients regret not getting the vaccine because they feel that COVID is so much worse than the vaccination would have been. A big concern is the media has shown increased risk of blood clots with the vaccine. But unfortunately, the risk of blood clots due to COVID is significantly higher than the vaccine incidence. So unfortunately, with this variant running rampant through the country, a vaccine is going to protect you from these things. Likewise, other side effects. Most of the side effects are very minimal from the vaccine. Have local inflammation or fevers for a day. With COVID, you have fevers for days on end. You have shortness of breath for weeks on end, and even sometimes a lifetime. So please get the vaccine, as the risks of severe side effects from the vaccine are significantly less compared to the side effects that you'll receive with a COVID infection. As far as the Delta variant, it does present a little bit differently than the previous variant. So, previously everybody was, kind of saying stay home, see how the symptoms go. But my recommendation is, as soon as you're having symptoms, big symptoms are chest congestion, shortness of breath, fevers, chills, don't wait to get tested. It's better to get tested. You're also eligible for the monoclonal antibodies or different treatments we have. The earlier we give those, the better off you will be. As I was saying, the Delta variant rapidly divides, it rapidly infects the lungs, and people get much sicker a lot quicker. So the sooner you get tested, the sooner you can be treated, placed on steroids or monoclonal antibody, the better off you'll be, and hopefully not be hospitalized. Unfortunately, this is a very crucial disease. The numbers in the area are going up significantly. The hospitalization rates are significantly increasing in the area. Likewise here in Norfolk and also the entire state and country. So it's better to quarantine, wash your hands, stay isolated, wear a mask, get treated and diagnosed as early as possible to stop the spread.